Explain to everyone what lipedema is and what's going on with Audrey.
Well, lipedema is a painful fat storage disease. And lipedema is a disease where the fat is really overgrowing and expanding. It actually has a mind of its own, and you get inflammation along with that, and pain many times, and swelling, and it progressively does get worse. And the only way to actually take care of lipedema is to go in and remove the diseased fat with specialized liposuction surgery.
And Dr. Amron, is there anything that you can do in your daily life to minimize it? I know she's tried undergarments, she's tried things like that. What do you do to deal with this?
Well, you know, unfortunately, that's the whole thing. The patients can do very, very little themselves. They've carried this thing really since puberty or the teenage years when it develops, and it tends to get worse. It really affects 11% of women worldwide. But there's not a lot a patient can really do. It's not going to respond to simply weight loss or even weight loss surgery. So really, the only way to really take care of this disease is to remove that fat.
Dr. Amron, I'm sure there's a little confusion out there for people listening to this. How do you make the diagnosis? How do you differentiate from somebody who has excess fat, lipodystrophy, and somebody has this condition, lipedema?
Or even extra fluid, lymphedema. What are the defining characteristics of lipedema?
Well, those are very good questions. I mean, it has a particular look to it, lipedema. It's a clinical diagnosis. There is no blood test for it. It's a set of symptoms that go along with it, many times swelling and pain, but there's a characteristic look to lipedema. And it's a column-like look to the legs from the buttock area all the way down. If you look in even Audrey's case, you kind of see that fullness going all the way down, and many times there's a cuffing and a swelling over the ankle going all the way around where the fat has overgrown that area. And many times it is confused with lymphedema, but it's a completely separate condition.
I am not fat. I have lipedema.
I am not fat. I have lipedema.
I'm not fat. I have lipedema.
I am not fat. I have lipedema.
I am not fat. I have lipedema.